Heart is a major pump, It pumps the blood all over the body. But heart is very selfish, Heart will pump blood to itself first. It will receive blood first and then pump it to all around. What will around all the pump blood to the other parts of the body? It will oxygenate the blood. It will purify the blood and send it across. All the tissues of the body will be equally and nicely oxygenated. Those impure blood will again recirculate through lung and it will be filtered and the carbon dioxide will be exhaled out by the lungs. So heart is a major pump, Without heart, we cannot survive. Health, this is a very broad term which you are trying to say, but heart is interconnected with the entire system, Heart is not only isolated pumping system. It is connected to your brain. It is connected to your kidneys. It's connected to your liver, lungs, everything, So if the heart is unhappy, the entire body is going to be unhappy. If the heart is not going to pump normally, suppose it is not pumping normally, the kidneys are not perfused properly. The brain is not supplied properly. Even the heart is not. Heart is a very selfish organ. It takes blood first to itself. So if it is not getting oxygen, it will show you signs of angina or pain or breathlessness. If it is not supplying good amount of blood to the kidneys will start failing. There will be collection of fluid in the legs or face. If the brain is deprived of oxygen because it is not pumping normally, or there is some same system and atherosclerosis in the artery supplying the brain, then the brain will start showing in the form of dizziness or a stroke-like symptom or some discomfort. So these are all, heart is a main thing which will eventually will be affecting entire system. Heart problems are diagnosed when the patient experiences some discomfort in the heart. He is not willing to go to the doctor because he fears that doctor will diagnose something and I'm not comfortable with that concept. So unless until he experiences some discomfort in the form of breathlessness or tiredness or chest pain or breathing difficulty on walking or climbing or chest pain, there is a leg pain or crampy pain in the legs or just tiredness, he'll visit us. And then during his routine examination, we'll find the diagnosis, we'll clinch the diagnosis that he is having blood pressure, he has diabetes or whatever, And we can then address that issue and try and control those issues. And then that is how. Second, by doing many examinations, blood examination, like we do routine blood tests, that is kidney function test, liver function test, ECG. ECG for heart patient. Heart patient, we have a battery of tests. Like first we do ECG. ECG will show two things. Either patient has heart abnormality in the form of rhythm disturbance or patient has a ischemic changes. So we call it less oxygen to the heart. The second is echocardiogram. Third is, as you must have heard, coronary angiography or stress testing. Then there are multiple complicated tests, stress thallium, then MRI and CT scan. All these tests are done routinely. Not routinely, they are done. If a person is, as it is normal, healthy person, every year, if he has a problem with the heart or blood pressure or diabetes, every 3 months. If person has undergone major event in life, like bypass surgery or heart attack, then probably every month. But if he's symptomatic, then he should visit very often till his main problem of breathlessness or swelling or discomfort is completely gone or decreased substantially. Large portion of food should be green leafy vegetables, high in fibers, low in fats, and good. You can have plenty of nuts in your food. You can have egg white, that is healthy. The best food to reverse heart condition, fish. It contains omega-3 fatty acid. And fruits, you can have as much as fruits you can have, That is how it should be. So healthy food contains foods which normally nobody likes it. Low density lipoprotein, lipoprotein A, and these have a direct link to the heart disease. If your LDL level is high, then your chances of heart disease are very high. If your LDL level goes below, say, 100, or if it is between 100 and 199, it is abnormal. If it is below 100, it is good. You have to take medicines if your LDL is high, blood pressure medicine, cholesterol medicine, diabetic medicines, blood pressure. All medicines should be taken for life or under the doctor's supervision so that he can guide you to reduce the dose or stop the dose if required. Eat fresh fruits, vegetables, do a lot of exercise, at least 30 minutes a day. You should avoid all those fried food, junk food, soft drinks, which contain a lot of sugar. So you have to eat whole grain and 5 portions of vegetables and fruits and less of salt, 6 grams of salt because you are hypertensive. If the person is hypertensive, he has to eat less of salt. These habits are to be inculcated in your lifestyle.